Good morning. My name is Dr. Melody Medley Keith, and I'm here at Lakeway Aquatic Physical Therapy. I am a doctor of physical therapy, and my specialty is biomechanics. So we look at the body biomechanically, understanding the lever system within our bodies. So today, our Snapinar is on sciatic pain relief. And let me just take a few minutes just to make sure that we are on the same page as far as sciatic pain. Because sciatic pain gets a lot of, oh, it's here on the side of my leg, it's here, that is not sciatic pain. What sciatic pain is, as we go into my little pelvis here, and again, of course, usually the pelvis, the tailbone is on the outside. So this right here is what we call our sacroiliac joint. This is your sacrum and your ilium, your iliac bone. And so where those joints meet up, that is SI joint pain. And there's many reasons for SI joint pain, but the way we look at it is that it is a pelvic obliquity. It is for pelvic abnormalities or joint dysfunctions within the pelvis, where one is not working right, or one is down and up or in, however we can do it. So what I want to do today is just give you some specific exercises for those of you that are having sciatic nerve pain. Now remember, this nerve runs to the back of the leg, okay? All the way down the back of the leg. So if you're just having it in the buttocks, that not necessarily is just sciatic nerve pain. That can be other things. But if you're having pain that goes all the way down the back of the leg into the buttocks, all the way down, because that nerve runs all the way down the back of the leg, all the way down to the foot. Now, sometimes you can just have it go into the back of the knee and up, and sometimes you can have it all the way down the leg. But if you've got nerve irritability into the sciatic nerve, then what we want to do is to make sure that you are addressing the pelvic issue. And that's what we're going to do today. That's what I'm going to show you. I'm going to show you some really easy things. Now, again, for some of you, these exercises are going to be way too easy. But I always caution in the side of going easy, and then we can always make it a little more difficult later. So for those of you that need physical therapy and are interested in coming in to see us, that would be great. Come on in. We can assess you and diagnose you and make sure and give you the right exercises for you. But for right now, I'm just going to show you just some general things that will help with sciatic nerve pain. So I'm taking just on your bed. You don't have to do these on the floor. You can do them on your bed if you want. For those of you that can get up and down off the floor, that's great. Get up and down off the floor. So the first one, I'm taking a couple of pillows because our pillows are really not real fluffy. And I'm just going to fold them in half, and then I'm going to lie right on my side. I'm going to stuff them right up at the top of my hip and pelvis bone and just lie right over them. I'm going to stack my hips, and I'm going to come in and go up and over for a nice little side stretch. Okay, I'm going to hold this for a whole minute. If you can stretch your leg out. If you can't, that hurts too bad, don't stretch your leg out right now. Just work on stretching the side. Okay? Then you would come over and you're going to do the same thing on the other side. Always do bilateral sides. Next one. I kind of call this like around the world because we go from one side to the other, then we're going to go on our front, and then we're going to go on our back, all using just a few pillows to help us with. So, and again, if you start with just a small pillow, you don't really feel a stretch, maybe get a little bit bigger pillow. If you want, you can also use a ball with this. All right. So your next one is just lying over, and again, I'm going to put it right on my hips. I'm going to get up, get on my hips, and lay right over, get my hips right on it, and then just try to get in. My knees are together, and my hips are down, and I'm pushing my buttocks down in. We call this a glute activation. Gluteal maximus, your buttocks muscles. Probably not my best view, right? Okay, so buttocks muscles down into the pillow, and I'm laying down and laying flat. I don't want you up, I want you down, head down. I'm going to try not to mess my microphone up, and squeeze into there, and back, and squeeze into there, and back. Now some of you, this is going to really hurt you. But if you can do it gently enough, do it easy enough, you will start noticing that the pelvis is going to move a little. All right, my last one on my around the world is taking it, and you're going to put it, again, not up back. I want you almost like sitting on it. I'm kind of getting my tushy on it. I'll bend my knees, and then I'm going to go all the way back. And this one is always a killer for you guys. So if this is too much for a lot of you, just take the pillow away and don't go so much. So in this, what I'm doing is pushing my belly button to spine and trying to stretch out a little bit. So this is going to stretch rectus abdominis because it's pubosacrally related, and it feels just so good. So again, just remember, take it slow. Start with a small pillow, then move into a little bit more of a pillow, and then eat little by little. You should start feeling relief in that nerve that you can really get in and do a bigger pillow or maybe even a ball. So we hope that you are enjoying our Snap-N-Rs. For those of you that send us messages and thumbs up, we really, really appreciate it. We like your feedback on these. So just keep sending us information on ideas that you want to hear about and things you want to see, and or questions that you might have about Lakeway Aquatic Physical Therapy and how we might be able to help you. Thank you very much. Have a great day. Bye-bye.